p.m. Time for our daily update. Let's start by remembering that even though we're in a difficult place, in a difficult time, we're going to get through this, and we're going to get through this together. And I haven't practiced this in a while, but we're going to get through this. We're going to get through this together. Let's remember that this is not going to last forever. It feels like that right now. It is longer than maybe we originally anticipated or we mentally or emotionally prepared for, but this is not going to last forever. We're going to make it through, but we are going to have to do what it takes to make sure as many of our fellow Kentuckians make it through with us, that we protect each other's lives, that we ultimately lift up our economy, and that we do everything we can to work towards getting our kids back in school. I want to start today with a little bit of positive economic development news. This morning, Dollar General Corporation announced plans to open 2 new distribution center facilities in the Bluegrass State, including a traditional warehouse in Walton, that's in Boone County, and a DG Fresh cold storage facility in Bowling Green, that's in Warren County. The addition of both facilities is expected to create more than 365 jobs for Kentuckians and support operations for more than 2,300 stores, and we're doing this in the middle of COVID-19. I think it shows that Kentucky is still a welcoming place for new enterprise, one where they see a well-trained workforce, and I think this is proof that while we are dealing with the crisis of the present, we are preparing for the future, making sure that we continue to create opportunity for Kentuckians. Construction on both facilities is expected to begin by September 2020, with plans for Walton to be operational by January of 2021 and Bowling Green by summer of 2021. I wanted to take time to thank Dollar General for this latest investment in Kentucky and our people. Protecting our workers is a top priority for this administration, and we're going to work to recover from this widespread economic impact of COVID. We're going to work on moving forward, not just maintaining, but moving forward. These new facilities will bring more jobs to their areas, and benefits will be much more widespread, boosting the entire region with revitalized business activity. Dollar General was founded here in the Commonwealth, and we're proud to be a central player in the company's continued success. Today, Dollar General operates in more than 580 stores in the Bluegrass State and employs more than 5,600 Kentuckians. So just a little bit of positive news that we are still creating jobs even while we are fighting a worldwide health pandemic. And while, yes, we are dealing with historic unemployment, we believe as long as Congress acts, provides state stabilization, continues to provide unemployment assistance, that we can have a rebound from this recession, get back into positive territory, and move ahead. Also, some positive news today on CARES Act funding for public transit. Our transportation cabinet was notified on Monday of an award of a little over $6.4 million from the Federal Transportation Administration to be awarded to 16 regional transit agencies serving 79 counties. Those are up here. I know they're a little hard to read, but it's because so many counties are going to share in this multi-million-dollar award, which is going to help us to help the people of those counties. Those transit agencies have been hard hit by the pandemic through lost ridership and lost revenues. It's important to keep them on the road because public transit is a lifeline to thousands of Kentuckians, and we need a healthy public transportation system as we come out of COVID-19. Transit drivers and other transit system employees have been on the front lines of battling COVID-19. They put themselves in harm's way to try to help protect others, protect their jobs, protect their ability to get groceries, help them get to the doctor, sometimes even when they're sick. The CARES funding can be used for a wide range of operating expenses, but much of it is going to be spent specifically for the safety and protection of employees and passengers. This includes purchasing masks, gloves, sanitizer, disinfection services, and protective barriers, the so-called sneeze shields, between drivers and passengers. Also includes electronic ticketing to reduce the person-to-person exchange of money. These are just some of the ways we can help transit employees and the public they serve be healthy at work. And I just want to take a minute to allow people to look at the number of counties that are here. This administration is committed not just to lifting up certain parts of the Commonwealth, but all parts of the Commonwealth. And you look on this, and it's everything from central Kentucky and the bluegrass to eastern Kentucky. I mean, you look on here, there's a specific award to help Harlan that's been hard hit recently in this COVID-19 outbreak. It's going to help public transportation there stay safe. Along with even areas in our west, as you look further down, the Pennyroyal Allied Community Services. So an announcement today that's going to help everybody stay safe while also protecting, investing in, and ensuring that we have the public infrastructure that's needed as we come out of this crisis. So today, our COVID update is a little bit better than yesterday. And in fact, after today's numbers, if you just look at Monday through Wednesday of last week versus this week, we're about 100 cases under where we were last week. Now, that's not going to be reflected in our positivity rate. That's a 7-day rolling average, so it depends on what number rolls off and what number comes back on. But today, we are announcing 546 new positive cases of COVID-19. Again, it's hard to believe that that can be good news, and it's not in so many ways. That's 546 additional Kentuckians dealing with this virus. But the trajectory that we were going on was terrifying. It's the same trajectory that states that are still dealing with the devastation to our south and to our west are experiencing, and other states appear to be headed in that direction. Again, today's number strongly suggests, and I believe is evidence of, facial coverings working and proving that even when other parts of the country may be escalating out of control, we can still control our own destiny here in Kentucky by simply doing this small act that shows that we care about one another. Total number of cases now 32,741. 2,029 of those are probable. The rest are lab confirmed. As the probable ones become lab confirmed, they're moved over in those numbers. Also today, one of our lowest death tolls in a long time. Today we're just announcing one new Kentuckian has lost their life to COVID-19. Now that is still one family that will need our help, will need us watching out for them. I don't think I have the line list here for that individual family. Sebastian, if you can make sure I get that before we finish tonight. I want to make sure that we recognize them in the same way that we've tried to recognize other individuals that have been lost, so that we put the same effort in our green lights and in ringing our bells. We pray and we think about this family and what they must be going through, like we have with all of the families. It brings our total death count to COVID-19 to 752. 4 of those are probable. The rest are all lab confirmed. As of today, we've got 620 Kentuckians currently hospitalized for COVID-19. We think we're going to be able to further refine and even enrich that data as we move forward. Our hope is to be able to provide data on the number of folks in the hospital that are confirmed COVID patients versus suspected COVID patients. When someone comes in, they have all the symptoms and they're awaiting a test, they are counted as COVID patients if that's what their doctor believes they have. I think we can add extra depth to that statistic as we move forward. Number of patients currently in the ICU, 131. Patients currently recovered, again, this number is just the best that we can do, 8,467, and our positivity rate today is 5.51%. That's up about 0.25% from yesterday. It's still, yesterday and today are higher than we want to be in that positivity rate. But when we looked at the escalation that we were on, we got to stop the growth before we can start diminishing or reducing both the number of cases, the rate of cases. The way I think about it is, if you're driving 60 miles an hour, you can't just immediately turn. You got to slow down before you can turn that car around. And please, everybody out there, don't try to disprove that you have to slow down in your car at that speed before you turn around. New cases by county: 104 in Jefferson, 59 in Fayette, 52 in Warren, 20 in Hardin, 15 in Madison. We've seen a lot more cases in Madison over the last several weeks. 12 in Davis, 11 in Barron, 11 in Bullitt, 11 in Kenton, 10 in Jessamine, and 10 in Scott, 9 in Franklin and Pike, and the rest are up on the website. This one is one of the hardest ones that every day, and it's just the number of kids under 5, because it's not going down. 21 today, kids under 5 have tested positive for the virus. And so when I got this today, I thought it was wrong, because the first number I saw under age said 18. And I said, we must be calculating this wrong. And over to the right, there's a column that says age unit, and it says days. So today, our youngest individual is just 18 days old. Thankfully, not hospitalized at this time, but let's wear our masks for this 18-day-old. Let's make sure that we are protecting one another when, it could harm the very youngest amongst us. 25 kids under 5, and it seems like we've had almost 20 every day. It's very concerning, especially when this is the group that before people have thought maybe spreads it less or maybe gets it even less. And it again is something that we got to look very closely as we get closer to any resumption of in-person classes, just the number of children that we're seeing coming down with the virus. Racial and ethnic data. I'm reading this right now about every 2 days. We update it every day because with the number of cases that have gotten in, it's not moving as much as it previously did. That's based on just volume. On total cases, non-Hispanic, 96%, 4% Hispanic. On race, 80.8% white, 14.86% Black or African American, 2.74% multiracial, 1.59% Asian. So again, we're seeing disproportionate number of cases in our Black and African American community. Also seeing disproportionate amount that's our death data. 96% non-Hispanic, 4% Hispanic. And then it's the death data: 80.8% white, 14.8% Black or African American, 2.7% multiracial, 1.6% Asian. That's the death breakdown. The cases are different, and at some point, delving into that data, the overall, if you look at just the ethnicity, overall cases 86% Hispanic. And 14% non-Hispanic. There's a big difference in who's getting the virus and who's passing away from it. Racial breakdown of cases: 78.66% white, 12.27% Black or African American, 6% multiracial, 2.44% Asian. So there's a lot that we still don't know about this virus and who would get it in what circumstance, but what we do know is areas where we see health disparities are suffering. That is our Black and African American communities. Certainly in terms of contracting the virus, our Hispanic communities. Our commitment has to be to do and to be better, and we can't wait until something like this, because you can't turn it around in time in the midst of a crisis. We got to make sure this never, ever happens again. Long-term care facilities. This is our update on active cases. 10 new residents. Here's a positive. These are active cases, remember, not just the cumulative. 5 less staff members, meaning they have recovered. They are noted over on the cumulative cases, but that is a positive move. On the cumulative cases, 29 additional residents, 16 additional staff. Sadly, 2 additional resident deaths, 1 new facility. We're going to get an update on this from Secretary Freelander here in just a moment. This week, again, right now, looking like we're even trailing last week, and we need this, folks. We need a week where we go down instead of go up, and that's in all parts of this. So we need your help to get there. I believe that you are doing the right thing, that the vast majority of people are wearing a facial covering, and it's making a difference. It looks like we are stopping a very dangerous situation from occurring. We need to keep it up. And I want to briefly recognize those that are helping to keep it up. This is Mask Up KY. That's what we've been talking about. Everybody making sure you wear this. We're going to start with the farmers market where they're doing it right and even selling masks at it. That seems to should be the very first stop on each and every one. This is in Berea, and this is one that is selling affordable masks to buy fabric to make and donate locally to covering for kids. So that's on the official donation list. First Lady appreciates it, but more than that, I mean, our kids do. Let's make sure that we have a facial covering for every child across Kentucky for when they enter school or for when they need it otherwise. All right, next one is showing a little spirit for WKU. It's bringing back this chalk art, and again, supporting that Mask Up Kentucky. If Big Red can do it, the rest of us can too. Here's our president of BCTC reminding that masks are essential, and again, just showing that type of leadership. Listen, when people are in positions of authority and leadership, and we wear these, and I do, and everybody on our staff does, I think it shows to other people that we're willing to walk the walk, and we need leaders at every level that are doing this. And I hope everybody who comes to Frankfort to show leadership or to push for something is going to be wearing one of these. It's the smallest act you can do to say you care about people. And if you're not wearing one, well, that you can be spreading it here, or you can get something here and take it back to your community. All right, last one. We have been asking people at this very difficult time for our restaurants and for our bars to order takeout. This is one of my favorite Louisville restaurants. It's one of the very first restaurants that my wife and I ever went to 17 years ago, I think, when we moved there. It's a special place for us. It looks like takeout is going strong. Please support your local restaurants, and thank you to this establishment for showing the importance of PPE and wearing that facial covering. All right, we're going to have two more updates here. We're going to hear about long-term care and SNAP from Secretary Freelander, and then our Lieutenant Governor is going to give an update on the Nettie Depp statute that's going to be, well, in the future here in the Capitol.
Thank you, Governor. The snap slide. So, here this evening to tell you that we want folks to sign up for benefits. We have had about 200,000 Kentuckians sign up for health care coverage through this website. Please sign up for health care coverage. It makes sense to have health care coverage during a pandemic. It also makes sense to have food during a pandemic. We've had about another 100,000 people sign up for SNAP since the beginning of this pandemic. Next slide. So what we've done is there was a specific time frame for folks to have to recertify for SNAP. We have now extended that time frame out so that if you have recertified, if you're in the process of recertified, or if you haven't begun the recertification process yet, we will extend your benefits out to make sure that during a pandemic you can get food. And that's a very important thing for us to do. So take advantage of signing up. When you get SNAP, you support your local grocers. When you get Medicaid, you support your healthcare industry. Without Medicaid, the healthcare industry in Kentucky would collapse. Without SNAP, there would be significant damage to our grocers and our local communities. Next, I want to talk just a little bit about long-term care. We are providing, through the CARES Act, funding for long-term care facilities to do that ongoing testing of their staff. We're asking those facilities to test every 2 weeks, and we're providing an avenue for them to get that testing paid for so that that doesn't fall as a burden on them. And we've contracted with labs, and even nursing facilities can get some reimbursement for collection of specimens. That contract is set up. We've got people who have signed up for this contract already, and we expect to get started and get all the way through a testing and a payment within the next few days to a week. And we're very excited about that because we think, next slide, we've done a good job in Kentucky. A lot. We hear the death totals, we hear the case totals in long-term care facilities. Every day the governor updates us on that. And it feels as though we in Kentucky, maybe we don't think we're doing a good job, a strong job. But I want to tell you this, we are. When you look at where Kentucky ranks in terms of the number of cases, and remember in Kentucky, our health care, we're usually about 47, 46, 45. We're in the high 20s. In terms of the best states in the country, in terms of our case rates and in terms of our death rates. And while when we look at the number of deaths in the state, a high percentage happens here, happens in nursing facilities. But as I've said often, these congregate care settings, these nursing facility settings, these long-term care settings, it's been a problem worldwide, it's been a problem nationwide, and it's been a challenge here in Kentucky. But when you look at our relative health status, we have done a very good job, and we are going to continue to do a good job because we're going to continue to try to provide the resources necessary to make a difference. And I believe we have, and I believe it shows in our rates. Thank you.
So with all of the anxiety and all of the work that we've been doing during this pandemic, I'm very happy that I get to bring some happy news today. In honor of the United States Women's Suffrage Centennial, which is on August 18th, and Women's Equality Day, which is on August 26th, I get to announce that the first monument honoring a woman, Miss Nettie Depp, will be coming to the state capitol. The unveiling of Nettie Depp Monument will occur next year on August 21st, 2021. This project began in 2014, nearly a year before the Kentucky Commission on Human Rights asked state and local governments in Kentucky to erect statues of women. A failure to observe women in places of honor narrows the vision of our youth and reveals a lack of understanding of American history regarding women's work, sacrifice, and the immeasurable and timeless contribution to society's advancement. Nettie Depp was a pioneer in education in Kentucky. As a teacher, a principal, and elected school superintendent in 1913, 7 years before women earned full voting rights in Kentucky. Nettie Depp advocated for improved education for every Kentuckian, regardless of their gender or their race. She was a true visionary in education reform, and she was also a suffragist. The impact Nettie Depp had on her community is profound and can be felt a century later. So may her life serve as a lesson to us all. We are honored that Ms. Depp's image will permanently serve as a proxy in our state capitol for all of the many unsung heroic women who have dedicated their time, talents, and hearts in service to our Commonwealth. I hope that by having the statue of Nettie Depp displayed in the Capitol, we can inspire the next generation of Kentuckians, promote gender equality, and highlight the importance of education and careers in education for the thousands of student visitors we welcome to Frankfort every year. I want the youngest Kentuckians to hear me today. If you want to change within your community and our society, follow Nettie Depp's example and become a teacher. Our future is in Kentucky's classroom, and Nettie Depp understood that, and she made it her life's work, and for that, it is an honor to honor her work. Thank you.
Lieutenant Governor? Amen, amen. Just to provide the final piece of my update from before, our Kentuckian that we've lost today is a 71-year-old woman from Logan County. Logan County has had some real loss. We're thinking about them. We're thinking about this woman and her family. And just to put it in context, I mean, my parents are in their 70s. I'm not going to mention where in their 70s, but you know, it ought to hit home to so many of us that we are losing people before they are meant to go. All right, we're going a little shorter today. We'll open it up to questions. I know I have some written questions here. There where they are. And we will start over here with Mike. The question is, do I think we're in position now for schools to open the third week of August? I'm watching the numbers very carefully this week. If it were today, I would suggest that they delay. We're still in a very uncertain area, and I'd like to see that positivity rate lower. I'd like to see us headed down, at least moving in the right direction. I have concerns on what I've seen in some of our other states, and I've talked to their governors, but about some schools that have opened and then immediately had to close. And we're in a tough, difficult time right now, and one of the most difficult parts of it is we don't have the luxury of planning 2 to 3 weeks ahead normally. The virus doesn't let us do that. And we all want to schedule. We want to schedule for our kids. We want to schedule for our life, and the virus just doesn't care. So we got to be real resilient in that area and in just about every other one. And I had a question here that's similar. As of today, is it possible you'll recommend postponing a return beyond the third week of August? That's certainly possible that we will make that recommendation. Karen? We're still moving forward. There's still conversations going on with the federal magistrates, separate conversations, because they're participating in it with the Kentucky Supreme Court and what their process might look like. I do believe we're making progress. We're not there yet. Separately, there's talks on Capitol Hill about extensions on federal or preventions on the federal side of eviction. So a lot of moving pieces there, not a lot of certainty. I do feel like we have had some, that the talks have been productive. Tom?
Where's the death statute going to be? Where's the space?
Well, the statue of Nettie Depp is going to follow the original plan for it, and its permanent home is going to be in the west end here of the Capitol. Now, we're going to put in place a process where we can consider what to do with the space that's available here in the rotunda. Want to make sure the process that's put together can be thoughtful about, first of all the different options beyond a who option. Would you do a permanent exhibit? Would you do a rotating exhibit that might allow multiple Kentuckians to be featured? Do we look at something else? Do we keep it open to increase the capacity, because we certainly have more room as we're here, and then to make sure that everybody can be heard on individuals they think ought to be honored. Joe? The news came out today that 29 athletes at U of L tested positive, and I hadn't read, but apparently many can be traced back to a party. This is the difficulty and the frustration, probably, that so many organizations and businesses face. That you try to put in the very best practices and procedures. Had one manufacturer that said, they've got everything up. They spent millions of dollars. They've cut down on their shifts. They feel very good about how their facility operates. And then 4 of their employees go to Florida and bring back the virus. I hear the same from some restaurants that think they're doing it right, and then their employees go to a party or go to a bar and bring back the virus. I think that this shows that there's going to be real challenges in both the operations of our universities and their athletics. It's going to take take significant participation, not just from administration, but from our students themselves, and it's going to be tough. We're going to have to watch it carefully moving forward. I hope that even in college athletics, we still believe that these are student athletes, and that we make sure we're prioritizing their health and their long-term goal, which I hope is a good education in addition to athletic success. Lawrence?
You mentioned a couple of times the past couple of days new restrictions coming on bars when they do reopen, including perhaps a curfew. Can you talk about what you're thinking about, and will bars and restaurants be able to reopen next week?
The question is on bars and restaurants. We hope certainly that we are on pace to increase our capacity at restaurants. One thing we're going to do before doing that is communicate with the White House that made the recommendations and monitors, just like we do, where we are and how much of an impact they think that we have. We were on a phone with Dr. Birx on something else, and she was watching the exact same data that we're in, believing that we're likely plateauing, but it's pretty early. Two things that we'll be looking at when we think we can reopen bars is one, just a strictly enforced seat rule. One of the major issues is people, not seated like in a restaurant, and thus coming together with folks they didn't come with. It's going to change the bar experience, but it's going to be necessary. Another that we're seriously looking at is the curfew. Most likely that would apply to both bars and restaurants, and hopefully cut down on some of the things that we see that the establishments may be trying to stop, but gets harder at some point. That probably have to require a change in the marketing or how some of these entities are getting people in. The one thing that we can't have, though, is people leaving a bar at 10 o'clock and then going to a party with 200 or 300 people. That's just going to continue to spread the virus further. And at some point, we each have a responsibility to each other, no matter what age we are and whether we think we're indestructible, to stop doing these things. What we're considering is what's being considered in other states. Most all states are doing that do this are doing 10 p.m. and that's something we're looking at. We're not there yet, but I've tried to be transparent about steps we may take. That's what we're trying to do here. Let me answer one of these. What are my thoughts on UK reopening and their plan going forward to be sufficient for keeping cases down once the 30,000 students move back to town? So I believe that UK's testing effort is an enormous effort. And provided that there's enough testing material out there for everyone, testing everybody when they come back is a good thing. The real challenge for UK and every other university is what happens once students are back. What is the way that you monitor students or maybe monitor faculty to ensure that the virus is not spreading, how you contact trace when there is a case, and how we create a system where we're really encouraging our young people not to engage in the type of activity that we wouldn't consider reckless on a college campus at any time other than now, and that probably most people out there participated in when they were on a college campus, but during COVID, we can't be doing that. So, Joe.
Talks about the Kentucky State Fair and what are your thoughts about it happening as it's currently scheduled to happen?
Question is on the state fair. We have had some additional talks. There may be an announcement from the Fair Board as early as tomorrow, as they are just consistently reevaluating. I want to let them be able to look over any of the newest thoughts and have that opportunity to speak on it first. Everybody involved in always monitoring where we are have been really responsible, and we appreciate that. Chris.
I have a follow-up, but I don't want to lose my one question.
We'll get to.
Okay, so when your administration spoke with the fair, did you give them recommendations following their latest recommendation? That was my follow-up. I'll still say my one.
So our conversations with the fair have been sending some recommendations over, getting some comments back, and then there have been a meeting. I don't know, I think it was telephonically, that included Dr. Stack and the head of the Fair Board, David Beck, the chair of the board, to sit down and really discuss where things were. I believe when the Fair Board is ready to make an announcement, it'll come from those conversations. Again, everybody has wanted to work together on it.
Amazing news. EKU kicker has quit the team, alleging not the locker room isn't safe, the coaches aren't doing anything. Does it make you curious about what is happening in a lot of our locker rooms at some of these universities?
So the question is on an EKU kicker that today I think left the team, worried that a safe environment was not being promoted. First, let me say I don't know any of the specific facts about EKU and what steps are and are not being taken. But I think it's a chance to comment on the fact that you can put out the best guidelines, you can put out the best recommendations, you can post things, in a locker room, but if you don't enforce it and make sure people follow it, it's not worth the paper that it's written on. Unfortunately, in some of the things that we've put out, we've seen it firsthand. That what we're told is we'll do anything if we can just play. And you put out the guidance, and then what you find out is by the second game, nobody's following it. And what we need here is for people to just understand the seriousness and to make sure that they put in place not just the rules and the regulations, but that enforcement mechanism. And I think as we go forward, whether it's our universities, whether it's our high schools, we saw an outbreak in a weight room where it's too small of a space, people needed to wear masks and spread out. That got 30-plus people. We really need to think about the enforcement mechanism, and that's not the labor cabinet coming around. That's communities looking out for each other. That's schools looking out for their individuals. That's parents looking out for kids that are involved, and it's a serious challenge. Let me read one, and then we'll come back over. Most up-to-date information in Kentucky, looking for info on University of Louisville football games and fans. First, I think we're still waiting to see exactly where the ACC, the SEC, and others are going to come down. I know they've adjusted their schedule and they've pushed games back. It doesn't mean that they might not push things back further. You look at KHSAA and the fact that they said we're going to move back and we're going to monitor the virus. I think that's where everybody is. I think whether there are fans in the stands depend on where the virus is and the plan and the enforcement that's there. What we've seen is if you really thin it out and you do enforcement, you can do it. But then, just as similarly, we see different venues across Kentucky not doing the enforcement at all, and the result that you get can be really concerning. Mike? The question is on reliability and tests and advice to Kentuckians, and for that I'm going to get Dr. Stack up here to give the actual medical advice.
So again, the question is about testing, and antigen testing was the specific question. It's complicated. So the most reliable test is the PCR test, and that's one that has to usually be sent to a laboratory. It's not one that you do point of care, like right there when you're in the clinic. Most of the tests that are done point of care in the clinic would be these antigen tests, and those are useful for people who have symptoms. If you have a fever, if you have symptoms, you probably have enough viral load in your system for those to be helpful, but they're often not as sensitive. And so there's other trade-offs with the antigen test. So there was initially for a long time only one of those. Now there's more than one of them, and I would just say I don't know the other two, I think, that are out there well enough yet to comment on them. And so I think you have to be careful. The best test to get if you have no symptoms and you want to screen yourself is one of those molecular diagnostic tests that you get like through the Kroger drive-through. The ones we do with Gravity, those are all the in-lab, high-quality molecular diagnostic tests. Those are very, very reliable, and that's what I'd recommend. And don't get antibody tests, please. Don't pay for antibody tests or serology tests unless you've seen a properly educated healthcare provider and you have determined that there is a specific reason you're getting it, because If you go and you trade your money for an antibody test and you don't know the specific test and the likelihood that a false positive is going to be produced, you could very well reach the exact opposite from the correct conclusion and just misinform yourself instead of helping yourself.
With the topic of testing, just wanted to take another opportunity to talk about new drive-through testing that is opening up tomorrow, most of these. This one is already live. This is our current partnership with Norton Healthcare that we were able to help provide some kits when community testing was going to dry up in this area. That's how you sign up. Our partnership with U of L starts tomorrow for most of these areas, the 3 different testing locations. You can call the number on the screen. It's all on our website to sign up. And then the last one, one starting on Thursday and one starting next Tuesday in Northern Kentucky. Make sure that you are regularly getting tested. It's a good way to protect yourself and others. Karen. Let us get a specific answer for you on that one. I mean, that's going to be down in the weeds of the law, and I want to make sure it's right. Tom?
Testing is down in at least 22 of the states. Overall, down 3.6%. People are complaining about having to wait for hours to get the test and then wait for weeks for the results to come back. We see that decline in Kentucky, or we hold it still.
The question is on testing nationally and here in Kentucky. I don't think that we are overall down in testing here in Kentucky. We have some instances where people have had to wait and wait too long, but that's really a location by location issue. We set one up for state employees, trying to make sure that we're getting testing done there for people who are coming in for in-person services, and we were able to keep our wait time relatively low. We have new areas opening up too that ought to help. All the little clinics that are now online are going to be doing walk-out testing, if you will, to your car. It does depend on turnaround time, what lab they're using. And that's one of these complicated things where we don't just have one overall testing lab, in the United States that's doing this. We have a whole lot of private and public and quasi-public entities that are doing it. Our Kentucky labs are turning around theirs much faster. Every now and then there's an anomaly or a reason something gets backed up. But we keep telling our in-state folks that we need 48-hour turnaround. And there are some that are using rapid testing where you go through, you pull over to the side, and 20 minutes later you get your result. That's not an Abbott rapid test, but some others that are out there now. Joe? We've had some, the question is on prisons. I don't have the numbers with me today. We can either send them to you tonight or we can provide an official update tomorrow with Secretary Brown, who's heading that up for us. We have not at this point decided to engage in mass testing in prisons that haven't had a single case. Part of that is testing supplies, but another is we believe that there is a way to monitor, and we're working on this project, wastewater coming out of a prison to determine if there is even a single case within that prison. If we can do that, then we have I think it would even be daily effective way of determining whether we need to come in and do that full-scale mass testing. I think we are seeing more cases in jails across Kentucky. A whole lot of them have gotten through 5 months, 4 months of keeping it out. But it's the way it's spreading right now. With the numbers we see, it's increasingly difficult. Lawrence?
You said based on today's numbers, you might recommend pushing back to starting school. Would that apply to schools that have already announced they're going online first, or?
I think that the question is about schools and what my recommendation would be today. If online, I mean, if in-person classes were to start today, and I had to make a recommendation, I would recommend to push it back. This is still pretty hot in Kentucky. It's still spreading. We have slowed down what could have been exponential growth. We just like to see that we can control it and get it on the decline. And what we're seeing in other areas is it's very hard to keep a single or a couple cases out of a school. And then depending on how you set up the school, how quickly the contacts can spread. Once you're in there, those that have decided to go ahead and start online should go ahead and start online as soon as they want. I mean, I need my kids to have more structure in their day. I think for the regions that I know have made that decision, I think it is a responsible decision based on my knowledge of where COVID is in that area, and also for many of them, the challenge. Our districts that have the largest number of kids that also have busing issues, their infrastructure is pretty old, making it a lot harder to spread out and to reduce the capacity. Now, where does that leave us? If we're going to have to do distance learning, we have got to solve our broadband issues, our internet connectivity issues here in Kentucky. And it tells us more than ever now that we should have a duty to ensure that every child has some form of a laptop or Chromebook and can get connected to the internet in their home, and we're not there. I'm not sure we're even close to there. But that's something that I think this virus is telling us that we have to do, not just to make sure that we can deal with something like this, but they're going to need that for the future. I mean, the world that we live in now is going to be forever changed by this, and you're going to need to have those capabilities. And we got to work towards that, Kentucky. I know we've taken some steps, but I think we're going to redouble our efforts. On the Kentucky Derby, we're still watching the numbers. I think there's a lot of different ways that event could happen, and I think we're gonna have some substantive talks next week. I think that Churchill is a willing partner to make sure we find the right way to do it depending on where we're at. I do have a question here about the National Street Rod Association event happening in Louisville and my take on it. Thousands of people look like they're going to go to that. It's going to be primarily outside, but we need that event to be enforcing all the rules. People need to be separated, and when they're within 6 feet, they absolutely need to be wearing masks, and if they refuse to do it, those folks need to be told to leave. And if they are exhibitors, they need to be told to take their exhibit with them. And if it absolutely can't be done, then they may have to do what we've had to do at different sporting events. I think one happened at the horse park, and that's shut it down during it if people can't follow what we need to see. Concerns about people coming from states that are part of the travel advisory. My hope first is that they wouldn't travel from a state like that right now, knowing what could happen. Otherwise, get a test right before you leave. If you're coming, whether you've gotten a test or not, wear a mask the entire time if you come from one of these states. Chris.
We have had some substitute teachers from JCPS contact us claiming that they were told to file for unemployment even though school was out. Now many of them are expected to pay back pay of thousands of dollars. At what point were they contacted to not apply for the weeks that summer break was in session? If they weren't, how are they supposed to know they should not?
I believe that the question's about substitute teachers and whether applying for unemployment in the summer. We got that advice from the Department of Labor. They clarified that. We put out that guidance. I can check on the dates that went out. That was something that we hated to see, but the Department of Labor, the U.S. Department of Labor, was pretty firm on our inability to pay benefits during that period of time.
You've spoken before about your faith and leaders at some of these public universities, but you've kind of touched on this, but how much faith do you actually have in an 18, 19, 20, 21-year-old to, make some good decisions?
Yeah, that's a heck of a question. The question is, what's my faith in some of our 18, 19, 20-year-olds to make good decisions as they head back to their universities? I can't claim I made all the best decisions at 18, 19, and 20. But I also wasn't in the middle of a worldwide health pandemic that could have harmed me. I'm sure I did things that were harmful for my health at the time, but it's hard, and we're asking so much of them. We're asking so much of our young Kentuckians at a time when they've been separated from their friends in a way that they never have before, at a time when their emotional and social health is so connected to those interactions, and I hurt for them. Because this is also typically a fun time in their lives and a stressful time in their lives, but one that they're in with other people and where you bond with other people in ways maybe that you haven't before. Some of my best friends in life were friends of mine from college, but we need to try to provide the best atmosphere to make the best decisions. We need to make sure we're doing from an enforcement end what we can to reduce the number of places they could go to make bad decisions. And then we need to be consistently talking to them as adults, because we're asking them to be really responsible adults at a time in their lives where we probably shouldn't have to ask that. Do I have faith in them? Yes. The challenge is there's so many of them, just like people of all other ages and what we will or won't see. I think people around me typically make good decisions, but there are times where I realize I'm going to lose that argument with my mom, and I can just make the best suggestions and guidance to her. So we need our young adults, especially as they go back to their university settings, if they want to be in their university settings, to know it's probably contingent on the vast majority of them making good decisions. And then be transparent with the universities about what happens if they don't and it spreads. Unfortunately, it has big ramifications. All right, so we're wrapping up in a little less than an hour today. Again, James, can you show our chart on where we were going? We think we see good signs and good news. I don't like our positivity rate being up. But with the direction we were previously headed, Kentuckians are answering the call, they're wearing facial coverings, and this is working. And now every public health official says this is the number one thing that we need to do. So I want to create an expectation, and we'll talk about it, I think, tomorrow, that we're going to have to wear these for a while longer, but it's working. And if it means that we can get even the things that we've had to reduce the capacity back open and everything else can stay open, and maybe we can do more of sports and other things, this is our chance. And remember, while it's uncomfortable, it saves other people's lives, and it's not going to last forever. We got to survive this. This is our challenge. It's going to take more lives of Kentuckians by the time we're done than Vietnam or the Korean War. This is something where we've got to get through it while protecting as many people around us. So mask up, Kentucky. I have faith in you. Let's get this done. Let's beat this virus. We'll see everybody at 4 p.m. tomorrow.